Good afternoon, and welcome. This is the Quite Trippy Podcast, and I'm your cousin Sherry. It's May 28th, and we've got quite a few posts already from Q today. I wanted to show you something. Take a look at this. Happy Q. I can't wait to fly this. I'm going to fly it from my mailbox. Whoops. Sorry about that. All right, let's get into the Q posts so far for today. And the first is 4336, and it is a Newsweek article. Q says, USA versus Japan. Reconcile critical thinking. And this article says, Japan ends coronavirus emergency with 850 deaths and no lockdown. Now, I'll just read the first couple of paragraphs because there's a lot more today. Japan's Prime Minister Shinzo Abe has announced the end of his state of emergency declaration for the novel coronavirus pandemic with just 851 deaths reported and without ever implementing a lockdown. I have decided to end the state of emergency across the nation, Abe said during a televised press conference on Monday. In just over a month and a half, we almost brought the infection situation under control. Abe cautioned that lifting the order did not mean that the novel coronavirus was gone from Japan. Our battle against the virus will continue, he said, while urging the Japanese people to continue following stringent social distancing guidance. So, there you have a reasonable-minded person. Of course, there isn't an election, and Trump isn't the president. So, that is that. We already know that. Again, apply your critical thinking. That was my critical thinking applied right there. The next drop is 4337 at 12:25 today. And it says, expanding on last drop. USA versus Japan. Apply. And there is an article from Forbes magazine. And I'm just going to read what Q says first before I click over to that article. Let that sink in. 42% of all COVID deaths are taking place in facilities that house 0.62 of the U.S. population, nursing homes. Why did our nursing home population suffer a direct hit regarding COVID-19 deaths? New York and New Jersey governor orders push COVID-positive elderly back into the nursing homes. USNS comfort capacity, plenty of beds. Hospital capacity, I don't know exactly, but it seems from the videos that the nurses were making that they had a lot of downtime and the furloughs, so that would lead me to believe that they didn't need their full staffs and they had some beds available. What other Democratic governors mandated same orders? Ask yourself a very simple question. Was it known by common sense and early medical reports, elderly community most at risk? Yes, it was. And the first one, if you remember, was in Washington at the Evergreen Nursing Home. Evergreen, a common theme around here. Another one of those code words that puts Hillary Clinton's stamp on things, which was her Secret Service code name. Why would 4 Democratic governors push COVID-19 infected patients into safe nursing homes? Ignorance is a choice. Why would they do it? They would do it because it's an easy way to get your numbers up, to get the disease to spread to the very people that we needed to protect the most. Okay, we'll go to that Forbes article now. And I'm going to read a couple of paragraphs of this one. It says, the most important COVID-19 statistic, 43% of U.S. deaths are from 0.6 of the population. And we've got a picture of DeSantis there. Americans are vigorously debating the merits. This computer's jumpy, and I apologize for that. Americans are vigorously debating the merits of continuing to lock down the U.S. economy to prevent the spread of COVID-19. A single statistic may hold the key to resolving this debate: the astounding share of deaths occurring in nursing homes and assisted living facilities. Nursing homes and assisted living facilities, the number one COVID problem. 2.1 million Americans, representing 0.62 of the U.S. population, reside in nursing homes and assisted living facilities. Nursing homes are residences for seniors needing help with activities of daily living, such as taking a shower or getting dressed, who also require 24/7 medical supervision. Assisted living facilities are designed for seniors who need help with activities of daily living but don't require full-time on-site medical supervision. According to an analysis that Greg Jervin and I conducted for the Foundation for Research on Equal there we go again. Opportunity, as of May 22nd, in the 39 states that currently report such figures, an astounding 43% of all COVID-19 deaths have taken place in nursing homes and assisted living facilities. Well, they're kind of restating the information over and over. It is on qmap.pub if you want to click over to this article and read the rest. But it's, that's a pretty astounding statistic, and it's painting a picture. It's painting a picture, and something that you won't hear on the news is stating the obvious. It's almost like it was intentional. All right, so the next drop is 4338, and that was at 12:40 today, and it says, expanding on the last drop, USA versus Japan. Apply. 43% of 100% nursing home death. CDC conflates 34 to 50% of COVID-19 deaths data include pneumonia, influenza. Average pneumonia influenza deaths per season, about what COVID is. What is the data? Why is the data constantly changing? The past data. Sometimes a Wayback Machine can find many Easter eggs. CDC data, then versus now. Ignorance is a choice. Okay, so apparently there's some changing of past data, which is very interesting. And I don't have the information, but I believe Q put it there for a reason, so I'm sure some wonderful Anon somewhere are pulling it up and showing everybody that the data's been manipulated. I mean, that's what it means when you change past data, correct? Okay, all right. We've got 4339 at 12:54 today, and there's a picture on an overpass that says Cuomo killed my mom, and that's just how sad. How sad is that? At what point should this be reclassified as murder? At what point is ignorance and common sense no longer valid or an excuse? Evil surrounding us. So, let's see what this is. Townhall.com. An article. Michigan's hapless governor continues deadly COVID-19 nursing home policy. Okay, here, so you have this wicked witch. It's bad enough that Governor Andrew Cuomo instituted the dangerous policy that forced nursing homes and long-term care facilities to accept COVID-positive patients against their will. It's bad enough that this policy appears to have led the rampant spread of coronavirus in New York nursing homes and, tragically, thousands of deaths in those facilities. And, is this an ad? Oh, and that's it. Okay, I thought that... Well, okay. I thought that was going somewhere. So, she's doing it also. That's what they're saying. I didn't review the Q drops before this. Okay. So that's that. And now we're on to 4340. And that came in at 1:03 p.m. And it's a New York Post article. Q says, at what point should this be reclassified as murder? At what point is ignorance no longer valid? Evil surrounds us. So let's see what this is. Nursing homes have no right to reject coronavirus patients, Cuomo says. Okay. Not now. Okay. New York's nursing homes weren't allowed to change a controversial order to admit patients with the coronavirus. Governor Andrew Cuomo said Thursday, even though said Thursday, even though it's been blamed for spreading the deadly disease among residents. They don't have a right to object. That is the rule and the regulation, and they have to comply with that, Cuomo said during his daily brief in Albany, so I guess he expects everybody to forget that. And the regulation is common sense. If you provide adequate care, you can't have the patient in your facility, and that's your basic fiduciary obligation. I would say ethical obligation, and it's also your legal obligation. Cuomo said that if a nursing home can't properly quarantine and treat COVID patients with separate staffers, it's required to move them to another facility or ask the State Department of Health to arrange a transfer. I don't think that happened. Now, when a patient gets transferred, they lose a patient. They lose that revenue. I understand, but the relationship is, the contract is, you have this residence, you get paid, and you must provide adequate care, he said. Health Commissioner Howard Zucker said during the briefing he was not aware that DOH had received any transfer requests. Cuomo also defended his Wednesday remark that it's not our job to provide nursing homes with personal protective equipment, saying we've given them thousands and thousands of PPE. This has got to be a little bit old, though, right? Let's see. What's the date on this? This is what he was saying back on April 23rd, 2020. So there's your proof right there. When they delete the executive order from the website, there's your proof. So, it's crazy that they really do think that you only remember the last news report. Okay, we're going to go on to the next one. And it says it's 4341 at 1:10 p.m. What time is it now? 2:15. Okay. It says, at what point should this be reclassified as murder? At what point is ignorance, common sense no longer valid? Excuse. Evil surrounds us. Okay, so we've got a New Jersey article and NewJersey.gov. And it is the order. On March 9th, 2020, Governor Phil Murphy issued an executive order during declaring a public health emergency. Let's see. Bobbity bop, boobity boop. Hospital discharge. Okay, so this is no patient shall be denied readmission or admission to the post-acute care setting solely based on a confirmed diagnosis of COVID-19. Persons under investigation for COVID-19 who have undergone testing in the hospital shall not be discharged until results are available. Okay. Post-acute care facilities are prohibited from requiring a hospitalized patient who is determined medically stable to be tested for COVID-19 prior to admission or readmission. That seems absolutely ridiculous. So, nobody thought of the step between the hospitals and the nursing homes, and that seems like a common sense question that I would ask if I had to plan this whole thing. So, I think that needs to be answered. Why didn't they have a place like Javits Center or one of those ships that they could hold these patients in until they were cleared of coronavirus and couldn't spread it to other elderly people? It's just maddening. I mean, I am so glad that my parents stayed healthy through this and just took caution, because they're in New York and they would have been in one of these situations. It's just terrible. All right, let's go up. Got 3 more posts to go. I'm sure he'll be posting more today, but I guess I can do those tomorrow. This is 4342 at 1:19 p.m. and it says again, at what point should this be reclassified as murder? At what point is ignorance, common sense no longer valid? Excuse. Evil surrounds us. And we've got it says perryhouse.gov. Let's see. And this is Congress, Washington, D.C., from the Inspector General. I respectfully request that the HHS Office of Investigations immediately commence an independent investigation into whether Pennsylvania Department of Health has contributed to an increase in COVID-19 infections and death in Pennsylvania nursing homes, assisted living care, and elder care. The urgency of this request cannot be understated, as Pennsylvania has made clear that the interim guidance will remain in place even as other states repeal or revise similar policies in response to the inordinate number of deaths in these facilities. Instead of a fairly and impartially assessing of the impact of the guidance on the high number of deaths, the Governor Wolf announced a criminal investigation into the facilities themselves. His breathtaking failure to protect the most vulnerable population in Pennsylvania warrants an independent investigation. I implore you to begin such an investigation immediately. And that's fantastic that they're actually sending this to Deputy Inspector Cantrell. And that's from Scott Perry, a member of Congress. God bless Scott Perry. Let's go back, and the next drop is 4343 at 1:28 p.m. and it says USA total population 328 million. COVID-19 deaths 100,000 during a lockdown. Japanese total population 126 million. Condensed island. COVID-19 deaths 850. No lockdown. 2 plus 2 equals 5. So something's fishy around here, Q's saying. Alright, we've got 4344. And that came in at 139. And Q says the truth is right in front of you. And it's a Breitbart article. 81% of Minnesota COVID-19 deaths are from nursing homes, but facilities still allowed to admit positive patients. So more and more and more of this, and it's happening, but it's happening in, coincidentally, Democrat-run states, Democrat governors, making these terrible decisions. So I'll just read the first paragraph of this because we're running a little long here, and I'm sure you've got things to do, and if you want to read more, you can read it later. If you do want to hear these full articles and you'd like longer podcasts, just write it in the comments section. I'm under the impression because I read the stuff for myself, I'm a visual learner. But if you guys have specific requests, I'm happy to do it. Okay, let me read this. State health officials and long-term care industry representatives have defended the practice of discharging some COVID-19 patients to nursing homes, saying it is part of a broader strategy to conserve critical hospital beds during the pandemic. Long-term care facilities can provide treatment for coronavirus patients who still need care, but have stabilized enough that they no longer require hospitalization, officials said. So far, 11 facilities statewide have been designated as COVID support sites, with separate units or wings to handle coronavirus patients. These specialty sites have gone through a vetting process by the state to ensure they have adequate staffing, supplies, and infection control standards. However, the other nursing homes have been allowed to admit COVID-19 patients under private arrangements with hospitals. The practice is widespread. The State Department of Health has reviewed the cases of about half the patients hospitalized for COVID-19 statewide. The agency found that 27%, or about 268 patients, were discharged to long-term care facilities since the pandemic began. The Minnesota Department of Health reports that as of Thursday, 663 out of 809 total COVID-19 deaths in the state were patients who became infected with coronavirus while residing in long-term care or assisted living facilities. Ugh. All right. So, Minnesota. Let's check that one off the map. The truth is right in front of you. So, it's crazy, and I'm going to bet that Q is probably going to give us some more examples of this today. And Congress has been, at least that one guy, Scott Perry, has been writing things to try and bring this center stage, but I don't know. I haven't heard anything about it from any of the legacy media's broadcasts. Just Andrew Cuomo's big fat face making up excuses. So, that's that. So maybe I'll be back later. And I did want to say, If you want to support this podcast, please, 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 right now, just click that little like button, wherever that is. Is it down there? Or down there? Or down there? Because I'd love to have more likes on my podcast. And more subscribers, of course. Oh, that was horrible. I apologize for that. And I do have the, on quitetrippy.com, the Patriot store. It's, you know what? I'm actually going to go to it right now. Since I've got you captive here. quitetrippy.com. Boop. And Quite Trippy with Cousin Sherry, you'll see this lovely designed website by me on wix.com. And right here, quite shoppily, we're going to hit the button. That's going to work. Okay. And when I say I've got some unique gifts, I do mean it. I'm always buying lots from auctions and excuse me, vintage stores and things like that. And I find some really great stuff. A lot of it is political, which is why I did the Patriot store. So you've got things like a set of RNC Presidential Victory Team lapel pins. You've got books on the origin of the Secret Service. So I've got lots of bunches of books. I've got military pins. I did have a lot of Native American instruments, but they are sold out at the time right now. Again, tons of pins, tons of great, like a manual, biological operations and nuclear warfare, which is pretty neat. I looked through that one. And I've got everything. And then we've got my artwork, which, you know, everybody needs to do something to keep themselves sane. And what I do is I paint cues and I paint other things like mirrors, and I make these trays out of resin, and I mix these natural mica paints and colors and make tiles and then put them into trays. They're really beautiful. If you could go to quitetrippy.com/patriotgifts, check it out and I don't know, purchase something if you want to support me. I do have a PayPal. I do take donations as well, but you know, once I get it going more, then I'll start doing the Patreon thing, because I don't feel that the content is that I have enough, frankly. But now that I'm trying to get a schedule together, I'll start asking for some patrons, and we'll have some live things, which I think will be great. I'd love to interact with some of you. I've gotten a lot of emails and a lot of support out there. Thank you very much. Oh, look, we got a Where We Go One, We Go All sweatshirt with those old vintage iron-on letters. Made that myself. We've got coins, we've got books, we've got the world on a cake platter, and some wind chimes. So, I don't know. These are the kinds of things, and I put up new stuff every day, and hopefully we can get some people shopping at the Quite Trippy Patriots gift shop. So that's all for today. Have a great day, and I will be back tomorrow with the continuation of Q Post from today and a special report on voter fraud. Thanks a lot. Like, subscribe. Bye-bye.